Infarct. Infarct is an area of ischemic necrosis. It is an area of ischemic necrosis caused by occlusion of either arterial supply or venous drainage. Infarct is an area of ischemic necrosis caused by occlusion of either arterial supply और venous drainage. या तो arterial supply या venous drainage के occlusion के कारण एक area of ischemic necrosis बनता है, that is infarct. Infarct is an area of ischemic necrosis caused by occlusion of either the arterial supply or the venous drainage. Types based on color: red or hemorrhagic infarct, white or anemic infarct. Basis of color: red infarct or hemorrhagic infarct, and white or anemic infarct. Based on the presence or absence of infection: septic infarct and bland infarct. On the basis of color: red or hemorrhagic infarct, white or anemic infarct. On the basis of presence or absence of infection: septic infarct and bland infarct. Red or hemorrhagic infarct occurs with venous occlusion. Example: testicular torsion. It is associated with loose, spongy tissues like lungs and tissues with dual circulation, lungs and small intestine. It is seen with sites of previous arterial occlusion and necrosis when flow is reestablished. या तो रेड और हीमोरेजिक इन्फार्क्ट जो है, it is because of venous occlusion. It occurs with venous occlusion. Example: testicular torsion. It is associated with loose or spongy tissues, that is lung, या tissues with dual circulation, that is lung and intestine, small intestine. Red or hemorrhagic infarct occurs with venous occlusion. Example: testicular torsion. Okay, it is an example of red infarct or hemorrhagic infarct. Red infarct जो है, it is associated with loose spongy tissues like lungs या tissues with double circulation, that is lung or small intestine. Red infarct is seen with sites of previous arterial occlusion and necrosis. When the flow is reestablished, it is seen with areas of previous arterial occlusion and necrosis when the flow is reestablished. White or anemic infarct, it occurs with arterial occlusion. It is associated with solid organs with end arterial circulation like heart, spleen or kidney. Heart, spleen or kidney, these are solid organs. Okay, these are solid organs with end arterial circulation. यहाँ पे white या anemic infarct होता है. White या anemic infarct is due to arterial occlusion. It is associated with solid organs with end arterial circulation like kidney, heart and spleen. तो on the basis of colored, रेड या वाइट होता है. रेड या हीमोरेजिक इन्फार्क्ट जो है वो लूज स्पॉन्जी टिश्यूज से एसोसिएटेड है, जैसे कि लंग, या टिश्यूज विथ डुअल सर्कुलेशन जैसे कि लंग और स्मॉल इंटेस्टाइन. अनीमिक या वाइट इन्फार्क्ट जो है, इट इज़ बिकॉज ऑफ आर्टेरियल अक्लूजन एंड दिस इज एसोसिएटेड विथ solid organs with end arterial circulation like heart, spleen and kidney. On the basis of presence or absence of infection: septic infarct or bland infarct. Septic infarct occurs with embolization of the infected cardiac valve vegetation or when microbes seed the necrotic tissue. Septic infarct, it occurs with the embolization of the infected cardiac valve vegetation. Infected cardiac valve vegetation के embolization के कारण या when microbes seed necrotic tissue. Septic infarct occurs with the embolization of infected cardiac valve vegetations. It occurs with the embolization of infected cardiac valve vegetation or when microbes seed the necrotic tissues. Septic infarct, it occurs with the embolization of the It occurs with the embolization of the infected cardiac valve vegetation or when the microbes seed the necrotic tissue. Factors that influence development of an infarct is anatomy of the vascular supply, rate of occlusion, tissue vulnerability to hypoxia and hypoxemia. Factors influencing the development of infarct is the anatomy of vascular supply, then rate of occlusion, tissue vulnerability to hypoxia and hypoxemia, anatomy of vascular supply. Tissues with availability of alternative blood supply are relatively resistant to infarct. अगर कोई टिश्यू है जिसमें एक ऑल्टरनेटिव ब्लड सप्लाई अवेलेबल है, that is less resistant to infarct, that is relatively resistant to infarct. या अगर कोई टिश्यू है जिसमें एक ऑल्टरनेटिव ब्लड सप्लाई है, तो that will be resistant to infarction. Rate of occlusion. Slowly developing occlusions are less likely to cause infarction. The slowly developing occlusions are less likely to cause infarction. Tissue vulnerability to hypoxia. Neurons undergo irreversible damage when deprived of their blood supply only for 3 to 4 minutes. ठीक है, अगर न्यूरॉन्स को 3 से 4 मिनट तक ब्लड सप्लाई नहीं मिलेगा, इट विल अंडरगो इरिवर्सिबल डैमेज. ठीक है, तो इट ऑल्सो डिपेंड्स ऑन द टिश्यू वल्नरेबिलिटी टू हाइपोक्सिया. जैसे कि न्यूरॉन्स अंडरगो इरिवर्सिबल डैमेज व्हेन डिप्राइव्ड टू ब्लड फॉर 3 to 4 minutes. Hypoxemia. Abnormally low blood oxygen content increases both the likelihood of infarction. Okay, so factors affecting the development of infarct are anatomy of the vascular supply. अगर कोई टिश्यू है जिसके पास ऑल्टरनेटिव ब्लड सप्लाई है, दैट विल बी मोर रेसिस्टेंट टू हाइपोक्सिया, दैट विल बी मोर रेसिस्टेंट टू इन्फेक्शन. सो पहला पॉइंट है एनाटॉमी ऑफ द vascular supply. दूसरा rate of occlusion. Slow developing occlusions are less likely to cause infarction. तीसरा tissue vulnerability to hypoxia. जो neurons हैं they undergo irreversible damage when deprived of blood supply for 3 to 4 minutes. Hypoxemia. Abnormally low blood oxygen content increases both the likelihood of infarction. Abnormally low oxygen level increases the likelihood of infarction. So factors that affect the development of infarct are anatomy of the vascular system or anatomy of the vascular supply, then rate of occlusion, tissue vulnerability to hypoxia and hypoxemia.